Welcome to the anatomical model of your eye. In anatomy, the superior eyelid is referred to as the superior tarsus. The lower lid is referred to as the inferior tarsus. The upper eyelid is controlled by a muscle called the Levator palpebrae superioris. Next, let's go through the parts of the lacrimal apparatus. This entire structure in brown is the lacrimal gland. This portion of the lacrimal gland is known as the palpebral part of the lacrimal gland, whereas the remaining portion is considered the orbital portion or the orbital part of the lacrimal gland. The lacrimal gland has ducts located here in green. Here on the other side, we see the lacrimal sac. The lacus lacrimalis. The lacus lacrimalis, the superior lacrimal canaliculi, and the inferior lacrimal canaliculi. Here at 12, we have the lacrimal papilla, or the lacrimal punctum. The structure at 11C is the lacrimal caruncle. Attached to the upper and lower eyelids are two ligaments. Here at number 4, we have the medial palpebral ligament. On the lateral side, away from the nose, we have the lateral palpebral ligament. Let's remove our eyelid and the lacrimal apparatus to reveal more structures underneath. The eye itself has 6 extraocular muscles. We have the superior rectus, the inferior rectus, the medial rectus, and the lateral rectus. In addition to these 4 muscles, we have 2 oblique muscles. One is the superior oblique, located on the superior portion of the eye that points towards the medial side, whereas the inferior oblique lies here inferiorly and points laterally. Remember, in this model, the medial side is going to be the side with more bone towards the nose. The outermost layer of the eye is sometimes referred to as the fibrous layer of the eyeball. The fibrous layer of the eyeball has 2 main components. The first component is the clear cornea that makes the outermost portion of the anterior eye. The other portion of the fibrous layer of the eyeball is the white sclera. The sclera is the white portion of the eyes. Some of the other structures that we can see is the pupil, which is a hole in the iris, and the colored portion of the eye, which is the iris. Moving this around, we can also see the optic nerve and more of the inferior rectus and inferior oblique. The lateral rectus and superior rectus. Looking at the medial view, we can see the medial rectus, the superior oblique, and the superior rectus, and also the optic nerve again. A portion of the inferior rectus too. The middle layer of the eye is referred to as the vascular layer of the eye. This gives us a better view of a portion of the cornea as well. Let's remove the vascular layer of our eye. In this model, all of the brown coloring indicates the choroid or the choroid coat. The choroid coat is known as the vascular layer of the eyeball, and it feeds the very hungry retina. The choroid coat is complete with ciliary nerves, shown in yellow. The choroid also contains the ciliary arteries in red, and the massive complex of the vorticose veins, seen here in blue. The vorticose veins is sometimes referred to as the vortex veins, given their appearance. In this view, we can also see part of the optic nerve, I'm able to see the iris, and I can see the hole in the iris, which is the pupil. Here at 4, we have the ciliary muscles. The ciliary muscles are going to allow for the lens to do a combination. In other words, the ciliary muscles can change the shape of the lens to focus the image onto the retina, whether you're focusing on something far away or close. Now that we're done with our vascular layer, let's go one more layer deep. At this point, we are considered to be at the inner layer of the eyeball. The eyeball actually has 2 chambers. There is one chamber that sits anteriorly. There's one chamber that sits anteriorly called the anterior chamber. That begins at the cornea and ends at the iris. In the anterior chamber, we have what's called the aqueous humor. In the much larger posterior chamber shown here, we have the vitreous humor. In this model, the vitreous humor is shown as this clear ball. Another rather obvious structure of the inner layer of the eyeball is the lens. Here is the lens. Notice that the lens is biconvex, whereas the cornea is only convex on one side. This will help you identify these on a practical exam. The shape of the lens is controlled by the ciliary muscles. This structure is called the ciliary body and houses the ciliary muscles. As we get closer to the lens, we can see the ligaments, the suspensory ligaments that connect to the lens in an area called the corona ciliaris. The corona ciliaris. Here we can also see a cross-section of the optic nerve. The wall of the eye has 3 layers. The outermost layer is the sclera in white. The middle layer is the choroid, and the innermost layer of the eye is the retina. The retina is denoted by the color orange on the inner layer of the eyeball. The retina contains blood vessels, which are the retinal arterioles in red and the retinal venules in blue. The retina contains rods and cones that are photoreceptors that are going to sense light and send signals to the brain. The centermost portion of our vision is located at this structure denoted as number 13 in this model. This region of the retina is called the macula. The centermost portion of the macula is called the fovea or fovea centralis. The fovea centralis will have the highest concentration of cones in the retina. Cones are responsible for perceiving color. We have red, green, and blue photoreceptors, and all of the colors of the rainbow are perceived through the differential activations of these 3 color cones. As we get more peripheral in our vision, rods become more common and cones less common. Our peripheral vision is much better at sensing movement due to the activation of rods in low light situations and being able to see contrast like movement fairly easily in the peripheral vision. There are several layers of cells within the retina. The last layer of cells in the retina is the ganglion cell layer. The axons of the ganglion cell layer come together and make a U-turn to exit the eye in the form of the optic nerve. The point at which the optic nerve leaves the eye is called the optic disc. The optic disc does not have any photoreceptors at all. For this reason, this is seen This is sometimes referred to as the blind spot. That's everything you need to know about the eye. Welcome to the model of the ear. One of the things you might notice first off is the portion of the external ear. The external ear is referred to as the auricle. The auricle. Sometimes in animals, we refer to this area as the pinna due to its ability to turn and face the sound. To turn and face sound. The auricle. You might recall that the external auditory canal travels through the temporal bone of the skull. This is a portion of the temporal bone. We will remove that to expose the external auditory canal. Hmm. Mhm. The ear has three regions: the outer ear, the middle ear, and the inner ear. The outer ear is composed of the auricle and the external auditory canal. So the auricle and the external auditory canal. The external ear ends at a structure called the tympanic membrane. Colloquially, this is called the eardrum. In anatomy, we want to call this the tympanic membrane. The tympanic membrane is going to vibrate as sound waves enter the ear through the external auditory canal. The middle ear is composed of the three ear ossicles. Ossicles means little bones. In this model, I can take out the tympanic membrane and I can see the structures more clearly. So keep in mind that the tympanic membrane is actually the border between the external ear and the middle ear. The structures of the middle ear are going to include the opening to the eustachian tube, which I'll show you in a moment, and the 3 ossicles. So let me show you what those ossicles are. One of the ossicles is attached to the structures of the inner ear. The other 2 are attached to the tympanic membrane. The 3 ossicles are called the malleus, the incus, and the stapes. Sometimes this is referred to in English as the hammer, anvil, and stirrup. The order in which these ossicles go is MIS, so you want to make sure you don't miss the question. The first bone that is attached to the tympanic membrane directly is the malleus. The malleus. The malleus is then attached to the incus. The incus here has a short arm and a long arm. And here, at 10, this portion of the incus is going to make contact with the stapes. The function of these 3 ossicles is to amplify the sound, because having this membrane move in the air is not very difficult. But once we translate this information from here to an air that is in an air medium to inside of these chambers, which has a liquid medium, we need a lot more force. So we use this trick of these 3 levers to actually to amplify the sound so that I have more force here at what we call the oval window. The oval window. So we've got the malleus, the incus, and the stapes. The malleus, the incus, and the stapes. Okay. Now, the innermost portion of the ear, or the inner ear, is made up of both the cochlea and the vestibular apparatus. So we can get this in focus here. So this is the stapes. The stapes is part of the middle ear. Everything else that we see here is part of the internal ear or inner ear. The stapes is connected to the oval window. The oval window is connected to the base of this structure here called the vestibule. So this entire structure here at number 13 is the vestibule, or maybe it's 14. So, but this is the vestibule here, the base of this structure here. Okay. Now, when the stapes is displacing fluid within these chambers, the fluid needs to have somewhere to go. There's no air in these chambers, so there's no room for displacement of the fluid. So we have another window below here called, so at 14, that is the oval window. And at 16, we have the round window. The round window is going to bulge along with the depression and the vibration of the stapes here at the oval window. Okay. Just like if we had a water balloon and you were manipulating one side of the water balloon, that water would need to go somewhere else, right? So it couldn't just be a static structure. Okay. So as this is moving up and down, this is going to be displacing liquid within this structure here that looks like a shell. This structure is called the cochlea. The cochlea has hair cells that are going to respond to the frequency of sound. So I actually have hair cells that it's pretty much set up like a big piano. And the hair cells are going to range from my lowest, or I'm sorry, my highest pitch sounds. I can hear from about 20 hertz to about 2000 hertz, depending on age and ability. But our highest pitch sounds are actually sensed by hair cells, which are located more towards what we call the base of the cochlea, which is here. The lower pitch sounds, interestingly enough, are sensed further along towards what's called the apex of the cochlea. For this reason, we see age-related hearing loss with the top high end of our frequency being what is lost first. The reason for that is just fatigue with age. So if you go to an audiologist, what is considered normal is going to depend on your age. So the hair cells are going to respond to certain frequencies, and only those hair cells within that frequency are going to vibrate. The strength or the volume is going to be depicted on how much or how strongly the stapes is being pushed. Okay. So the information from the cochlea is then sent through the vestibulocochlear nerve, and that is then going to go to the brain for perception. And we also have another sense here, which is our vestibular senses, or the vestibular nervous system. The vestibule is located here. Within the vestibule, we have the utricle and the saccule. So within these structures, in the ventricle itself, we get our sense of linear acceleration. In other words, if you were falling out of an airplane, going up in a rocket, or if you are traveling horizontally, maybe you're in a car and you slam on the brakes and then slam on the gas, or slam on the gas first and then slam on the brakes, maybe makes more sense. But when you're doing that, you actually have these little rocks inside of the chambers of the utricle and saccule, which are moving along with, which are moving opposite to your acceleration. So it's your acceleration versus gravity. And as those rocks are moving, you have hair cells within those chambers, and those hair cells are giving you that sense of acceleration or falling or accelerating quickly upwards, and so on and so forth. The other portion that we have of the vestibular system here are the three semicircular canals. Now, the semicircular canals are going to give us our sense of rotation. So we actually have crystals that are located within each of these three semicircular canals. We have three of them. We've got the anterior, posterior, and lateral semicircular canals. And each one of these is in a different plane of orientation. So you can think of this as one on each of our three dimensions of existence. One on the X plane, one on the Y plane, and one on the Z plane. And these are going to give us our sense of rotational acceleration. So in other words, if you're nodding your head yes, shaking your head no, or putting your head on your shoulder, either side, those would be the three planes of motion. And everything in between would just be a combination of what these three semicircular canals would perceive or would sense. And then perception would happen at the level of the brain. So both the information from the cochlea and the vestibule, along with the semicircular canals, that information goes from this apparatus to the brain through the vestibulocochlear nerve. The vestibulocochlear nerve. One more thing I want to mention here is the eustachian tube. The eustachian tube, also known as the auditory tube, is an opening to allow for the pressure to equalize between the middle ear and the pharynx, which is the throat. So this is what sometimes gets plugged up, especially if it's a baby and the baby has a sinus infection and is up in an airplane. It can be very uncomfortable and maybe makes the baby fussy. This is also what you might feel if you are taking a trip up to Big Bear. If you're taking a trip up to Big Bear, then you might notice that, oh, my ears need to pop. Okay, so this is due to the eustachian tube or auditory tube. So it equalizes the pressure between the middle ear and the outside environment. Thank you for watching.